Hi there, folks. I'm Dr. Burke with Pathways Integrative Health Center. In our office, we specialize in supporting and caring for people who suffer with long-term chronic conditions. And one of the things we almost always find, regardless of what the person walks into, whether it's long-term peripheral neuropathy, chronic pain, brain fog, sleep disorders, digestive issues, weight issues, whatever it might be, very frequently there's an underlying undiagnosed poorly functioning thyroid. Now you might be sitting here thinking, well, Dr. Mays, I went in, had some labs done, they said my thyroid's fine, the way I feel is not due to my thyroid. Or maybe you went in, they did some labs, said your thyroid is off, gave you some medication, now your labs look perfect and you still don't feel good. And while I know that's only a very small part of the picture, the thyroid is very complex and lots of areas can not work the way they should. So I'm going to give a very quick review of how the thyroid works. You know, it starts up here in your brain, where your brain needs good, healthy brain chemistry to work. And that tells a part of your brain called the hypothalamus to release a hormone called TRH. Don't worry, we're not going to quiz you on this, but it goes down and tells the pituitary to make a hormone called TSH. Now you might have heard of that. That's what they usually check on a standard thyroid workup. Now TSH goes down to the thyroid gland and tells your thyroid to do its job, to start making thyroid hormones. It takes things like iodine and zinc and selenium and combines with some different proteins to make your thyroid hormone. It does that in two different forms. One form is T3. That's the active form. That's what does the work. And the other part is T4, and that's inactive. That's what 94% of what your thyroid makes. So what happens is then that's carried out by a protein called TBG. And that's kind of like a bus carrying workers out to a job site. So that TBG carries the T4 out to places like your liver. Your liver does a lot of your conversion. About 60% of your inactive T4 is turned into T3 in your liver. Another 20% is done in your gut, and about another 20% is out in your tissues. And then that's all that active hormones carried out to all your cells in your body. Now keep in mind, every cell in your body has a thyroid hormone receptor to it. And a receptor, we think about it's kind of like the receptor is like the lock on a factory. And then the thyroid hormone is like the key to the lock. So the thyroid hormone comes up, slides into the lock, opens the door, turns the cell on, and makes the cell do something, whatever it's supposed to be doing. And then up here, there's some regulatory systems that help your brain know you have the proper amounts of thyroid hormone and keeps everything in balance. Now that's very simple, and it can go off rail in a lot of different places. For instance, say you're under a lot of stress, high elevated cortisol. We all live in high stress environments. That's going to shut this whole process down up here. Or say you don't have the good feel-good chemistry, the dopamine or the serotonin. Maybe you have some depression or some anxiety. It might not even be diagnosed. You just know you're not as happy or as well balanced as you used to be. Or blood sugar issues will shut that down up in here. Or we come down here, pituitary is not working right. Or you don't have enough of the right minerals, the iodine, the zinc, the selenium to help make the proper hormones. Or in some situations, you might actually have an autoimmune condition. That accounts for about 90% plus of people with thyroid disorders, is there some underlying autoimmunity. And that's where your immune system has gotten confused. And it's either attacking the enzymes here in your thyroid gland that make the thyroid hormone, or they're attacking the proteins that carry the hormone out throughout your body. Come on further down, just to say your liver isn't working as good as it should be. Say it's stressed out by toxins in the environment, or there's hormonal overload, or there's blood sugar issues, or inflammatory issues, that's going to slow that conversion down. Or gut issues. If you have indigestion or chronic heartburn or bloating, or just things don't digest as well as they should, that's going to really affect that conversion there. Out here in the tissues, that's been things like hormone, too much estrogen, too much testosterone, or too many compounds in the environment that mimic those things in your body, blocking that conversion happening here out in your tissues. Or at the level of the cell, blood sugar is going to affect this whole process. Or again, hormone imbalances will block the activity of the hormones in the cells. So the point I want to make just with this short little intro is that thyroid can be affected by a lot of different things. And really the key to addressing those isn't just throwing more hormones into this little area right in here. It's really looking at where are the different places where things aren't working to start to restore function so your body can function the way it's supposed to. Now, if you look at this, as some of this makes sense to you, I invite you to contact us. I do for everybody that calls me when they hear this video. I will do a courtesy consultation with you to see if we might be able to provide you with new options to get your health back. So I invite you to call us. You know our number, 763-634-5892. You can reach out to us on Facebook. You probably saw this on Facebook at the Pathways Integrative Health Center. Or email us, drmays@askdrmays.com. And otherwise, if you choose to take some steps, I look forward to talking to you. Otherwise, have a healthy, happy day. Thank you very much.